Hello, today we are talking about something different. We are talking about this concept that I'm going to play right now. And this is a scene from one of my favorite shows ever. But before I begin playing it, I encourage you to really listen to the concept and to the point that the scene and David Rose here is trying to make.
Um, I do drink red wine, but I also drink white wine.
Oh,
And I've been known to sample the occasional rosé. And a couple summers back, I tried a Merlot that used to be a Chardonnay,
oh,
which got a bit complicated.
okay. Yeah, so you're just really open to all wines.
I like the wine and not the label. Does that make sense?
Yes, it does. Um,
All right, so that was such a wonderful scene. And comment Schitt's Creek below if you've also seen that show. And really, the biggest point of that scene is David telling Stevie here that he likes the wine and not the label. Now, what the fuck does this have to do with our client results? This is what I encourage you to think of. I'm going to ask you a few questions and you get to be honest with yourself here. When a client comes to you saying, I have complex PTSD, I need some help, what emotion and what kind of thoughts does that bring to you? That label of CPTSD. Or, I've had this problem for 25 years. I've I have so much going on in my life. I have A, B, C, D, E, F, G, all the way to Z. And I have all these problems. How do you respond? And what are your beliefs with regards to clients coming to you with that, right? Like I have CPTSD, I have all of these things, I have ADHD, and all of the labels and diagnosis that they have, right? Now, this is not to discredit any of that. This is really just more of a reflection for you to think of how you currently perceive these labels. And so, what I really want to make, the point that I really want to make here is to help you see things differently, right? That's what this is all about. And instead of treating the label, right? Red wine, white wine, Chardonnay, Merlot, Cab Sauvignon, like instead of thinking of those labels, why not just focus on the why? Why not just focus on the client in front of us, right? Our clients have been placed all of these labels, and these labels have been given to them by society, by Western medicine, by themselves. And these labels, when we allow those labels to go into our session, it not only puts pressure on us, but it also biases the direction of our sessions and it biases the direction of the transformation. Now, I know that this makes a lot of sense, right? Of course, this makes a lot of sense. However, we were trained in traditional trainings to label, to symptomize, right? If you were trained in traditional methods, if you were trained in NLP, you were taught to be like, if your client has this problem, have them float above their timeline. If a client has smoking problems, then you need to do this visualization. That is treating the label, not the line, right? And so this is really what I encourage you to think of in your practice. How are you seeing your clients? Inside the hypnotic questioning trainings, the very first exercise we do is detachment. And one of the things that I encourage my students to really think of is detaching from the label, detaching from a presenting problem of it being small or big or complex, and really just focusing on the person in front of them. And what that does is not only is it a fucking powerful concept to surround our practice with. It also is something that lessens the pressure on the practitioner to figure things out, because we know that it's not up to us to figure things out, right? So if there's like a label, like a red wine, we have expectations about red wine, right? What the taste of it is, right? It's got to be room temperature or whatever. But if we remove that label, some people love ice in their red wine. Some people love sangria, right? Red sangria. And seeing it in this way, treating the person in front of us exactly as they are instead of the labels that society and themselves have given them. Focus on the client in front of us, because really what that does, it helps us tap into our curiosity instead of the labels, right? And this is easier said than done. This ingrained belief and this ingrained bias is so deep within us, that we really want to be aware of this. And so this video is really just to show you and to help you see things differently. And ever since I have really intentionally looked at my client as a wine and not the label. I looked at my client as someone who just really wants to put themselves first instead of being in a narcissistic relationship, which is what I worked with, which was what I worked with before. Instead of seeing a client with breathing issues, I just saw the client holistically as they are. And what that did was really see my client for them as a whole person. It negated the biases that we tend to have as human beings. And because of that, sessions were much more flowy, results were faster, because I'm not placing an expectation and an outcome on the session because someone told me that CPTSD is something that takes months and months and months and months. To be quite honest with you, my clients did have that diagnosis, whether or not it was present. But instead of focusing on that label, I focus on the person. What is it that they need help with at this moment? What is the biggest thing that's bothering them? And how can I help them get unstuck and heal that as fast as possible so they can live their life? That is really what the neurosync hypnotic questioning method is all about. That's why we never use scripts. That's why we never use techniques, because it's about working with a person in front of us and working with any person in front of us, regardless of the label, their symptom, on the spot. And of course, we can get into the discussion of scope of practice, but that's not the point here. This is more of a big picture, how you want to see your clients moving forward. So what are your thoughts on this? I would love to know, and I hope that made you think, and I will see you later.